Today we are going to talk basics about diabetes. Diabetes is a deficiency of insulin in our body. It could be an absolute lack of insulin or it could be a relative lack of insulin. What happens when there is a deficiency of insulin in our body? Whenever there is a deficiency of insulin, our body is not able to regulate the sugar level in the blood. Whenever we eat some food, our body should release insulin corresponding to what we eat. So, suppose we have plenty of sweets, more amount of insulin should be released to combat this sugar that we have eaten, and the blood sugar should be regulated automatically by the increase in insulin. Very common question asked by patients is, when they have a diabetes, is what should they take care in the house? So basically, if we talk of diabetic emergency, there are two basic type of diabetic emergency which can happen in a particular patient. Either his sugar can go down drastically, which will cause an emergency, or slowly over a period of few days, his sugar can keep on increasing, which can lead to a different kind of emergency. So the most common emergency which can occur in a diabetic patient and can also be life-threatening is hypoglycemia. What do we mean? What do we mean by hypoglycemia? Hypoglycemia means low blood sugar, and the sugar which falls and causes symptom leading almost to unconsciousness is called hypoglycemia. Many patients ask us that suppose my relative or a near and dear one has a low blood sugar, what should I do at that time? The immediate action to be taken at that time, if possible, is to check the sugar on a glucometer, or the symptom. You have to identify the symptom of hypoglycemia, that is a low sugar. A person might become irritable, might become angry, might start perspiring, might start feeling hungry. These are all symptoms of low blood sugar. Immediately such a patient should be given some sugar or glucose powder or a sugar-filled drink immediately. Now, if the person becomes unconscious, do not try to make a person drink. You can simply apply glucose powder onto the gums and oral cavity. A very important point for young ladies is diabetes and pregnancy. Now there are two situations. Either a lady already has diabetes and now wants to become pregnant, or a lady becomes pregnant and then it is discovered that she has got diabetes. When a lady becomes pregnant and diabetes is discovered, this is called gestational diabetes. Diabetes during pregnancy. It's very important during pregnancy the blood sugar should be kept under good control. So it is very important for the couple to visit their doctor on a regular basis, check the sugar on a regular basis, have a good diet habit, and make sure that the sugar doesn't go out of control. A very important question comes up with a diabetic patient is when to take medicine. Now the medicines are usually, there are some medicines which could be once a day, there will be some medicines which will be twice a day, there will be some medicines which might be 3 times a day. The doctor will advise you when to take the medicine, whether it's to be taken before meals or to be taken after meals. There are certain medicines which necessarily has to be taken after meals. Otherwise, there might be some side effects, discomfort to the patient. Adhere to the advice of the doctor. Adhere to the timing of the medication. Do not postpone the dose of the tablets. Do not skip the tablets, or else the sugar can go out of control.